Dear viewers, welcome to all. Today we'll talk about the features of third nerve palsy. So let's see. Now, before going to in details of the features of third nerve palsy, we will review the extraocular muscles. There are 7 extraocular muscles. 6 of them we have shown here. The 7th one, which we have not shown here, is levator palpebrae superioris muscle. Levator palpebrae superioris muscle is the prime elevator of upper eyelid. Now the 6 muscles we have shown here, 4 recti muscles and 2 oblique muscles. This is superior rectus, this is lateral rectus, this is inferior rectus, this is medial rectus, this is superior oblique, and this is inferior oblique muscle. Now come to the nerve supply of these muscles. Most of these muscles, including the levator palpebrae superioris, is supplied by oculomotor nerve, except the lateral rectus, which is supplied by abducent nerve, and the superior oblique muscle, which is supplied by trochlear nerve. So if there is lesion in the third nerve, then what will occur? Let's see. Here we have put cross in the muscles which will be paralyzed due to oculomotor nerve lesion, and you can see the paralyzed muscles are superior rectus, medial rectus, inferior rectus and inferior oblique muscles, but lateral rectus and superior oblique muscles are intact, as the lateral rectus muscle is intact and the superior oblique muscle is intact, and we know that lateral rectus muscle will cause to move the eye laterally or abduction, and superior oblique muscle causes the eye to go downwards or depression. So what will be the condition of the eye? As the lateral rectus pulling the eye laterally and the superior oblique pulling the eye to downwards, so the eye will remain downwards and laterally, and in other words we can say that it will remain downward and outward. And as the eye is away from the midline, we in another language call it strabismus or squint, and here it is divergent squint, that is away from midline. What will be the binocular vision? If the patient wants to see something in front, then the axis of the unaffected eye is in normal axis, but the axis of the affected eye is in another direction. So one object will seen by 2 eyes differently, so there will be double vision or diplopia. What will be the condition of the eyelid? As the prime elevator of eyelid is levator palpebrae superioris and is supplied by oculomotor nerve, and there is lesion in the oculomotor nerve, so the levator palpebrae superioris will also be paralyzed and there will be drooping of the upper eyelid, and we call it in another language ptosis. So what will be condition of the pupil? As you can see here, comparing the pupil of this eye, that is left eye, if you compare this eye, then you can see the pupil here in the affected eye is dilated. So how pupil will be dilated? Let's see. To understand this, please come to this picture. Here we have shown the constrictor and dilator muscles of pupil. This muscle is called the constrictor pupillae, which is circular and is supplied by parasympathetic nervous system, and these are the dilator group of muscle or dilator pupillae in radial manner, and this causes the dilatation of the pupil and supplied by sympathetic nervous system. As the parasympathetic fibers for constrictor pupillae is conferred by the oculomotor nerve, and if there is the lesion in the oculomotor nerve, so parasympathetic fiber for constrictor pupillae will also be damaged and the constrictor pupillae cannot work. So the radial group of muscle which is supplied by sympathetic nerve will take the upper hand and the pupil will remain dilated. But in some conditions pupil may be spared, that is pupil may be normal. So let's see how and in which condition it may be like that. Here we have shown the nerve fibers of the oculomotor nerve. The yellow color is the motor fiber and the green color is the parasympathetic fiber. Parasympathetic fiber remains in periphery and is supplied by the pile vessels, and the motor fiber remains inside and is supplied by the vasa nervorum. So any condition involving vasa nervorum such as hypertension, diabetes mellitus will cause the damage to the motor fiber of the oculomotor nerve. So there will be involvement of the extraocular muscles where the parasympathetic fiber will be spared. But if there is any compression which easily involve the pile vessels and will damage the parasympathetic nerve and the pupil will be involved. And if the compression is more, then it will also involve the motor fiber and there will be complete third nerve palsy. Now come what we will find during examination of the eye. In the neutral position, the affected eye will remain outwards and downwards. And if the patient looks towards the affected side, then in the affected eye there is no change, but the opposite eye will remain adapted. And if the patient looks opposite to the lesion, then there will be increment of the strabismus. And as we shown before, the pupil will be dilated in the affected side. If we examine the light reflex, then direct light reflex will be lost as the circular muscle is affected due to parasympathetic nerve impairment, but the consensual reflex of the opposite eye will remain normal. So what is about the accommodation reflex? You can see here the convergence of the affected eye is not possible because the medial rectus cannot work and the pupillary constrictor muscle cannot work, so pupil will not constrict, and the contraction of the ciliary muscle which is necessary to relax the suspensory ligament of the lens to make it more convex is not possible because ciliary muscle is supplied by the parasympathetic nervous system conveyed by the oculomotor nerve. So there will be loss of accommodation reflex for near vision. So in summary, we can memorize these things with some teach and loss. The first T is drooping of the upper eyelid or ptosis. Second T is downward and outward eye. Third T is divergent strabismus or squint. Fourth D is dilated pupil. Fifth D is diplopia. And there is loss of direct light reflex and loss of accommodation reflex for near vision. So thanks for watching. Wish you will watch my next video very soon. Thank you.